Hello, I'm Jim Demon with Clark County Close-Up. Vanessa, thank you so much for meeting with us.
Thank you. Thank you for having me.
So, what is the role of community services?
So, the Department of Community Services is one of the county departments. We manage federal, state, and local grants and contracts around social services for the county. So, we tend to do a lot of work with nonprofits, for profits, faith-based, and other local jurisdictions around various social services like developmental disabilities, behavioral support, housing for affordable housing, low income, some homeless services to help veterans that are indigent, different type of programs around the social services field.
Okay, so how do you work? I realize the funding, but how do you work with these partners, funding partners, to enhance the services received by the public?
So, our budget annually is about estimated about 30 million from all those funding sources. And we actually contract out about 85% of that to various providers, whether it's nonprofit, for profit, or faith-based. And so we work directly with them. We do more of the monitoring and administrative role, and the providers do a lot of the direct services in the community.
Okay. Now, obviously, the pandemic has had a huge impact on everyone. First question: how did your department pivot operations to working mainly remotely during this period?
So, since the pandemic started, we actually went completely online and operate virtually. So, our main offices in the Center for Community Health are closed at this time. And so, we currently do everything we do through telephone, email, through the online virtual meetings, our webpage. And so, we were able to continue to keep going. We did not shut down. So because our main function is administrative, we're able to continue to pay providers, provide the reports, and do any auditing that is required from our funding source. I do have one particular area, which is our behavioral health designated crisis responders. They're considered to be essential workers. They are still seeing people in person. They're the ones who detain you against your will if you have a behavioral health disorder. So that's the one area that still is out in the community, and have been in the community working since the pandemic.
Now, you had mentioned we talked about funding partners. What kind of, and you use contracted support for much of it. What kind of strategies do you use to try to get the most bang out of those dollars that come in?
So, when we received the money, and it happened fairly quickly back in around March, early April, we actually needed to rely on a lot of our providers that are already in our network that we have contracts with. And so we pulled them together fairly quickly and came up with strategies so that we kind of knew what the requirements were, worked with the state and the federal government and the county officials. And then we put those contracts in place. I had some wonderful staff that worked really long hours to make sure that we were ready to go. And we were one of the first counties out the gate starting towards the end of April to start delivering some of this funding because of the pandemic.
So, with so many people losing their employment so quickly, housing became a major concern very shortly
Yes.
after the pandemic. How has your department assisted with keeping people in their residences during this pandemic?
So, one of the largest, the total amount of money up to date has been a little bit over 15.6 million, and it helped with a variety of services. But the largest amount of funding was for rental assistance, and so and we were able to kind of help, with rental assistance, utility assistance, and help some providers with PPE and some legal aid, and some meal services. And so it's probably been over 6,000 people that we helped, stay in their home with utility assistance, and get access to food or whatever assistance they needed. So we were very fortunate that we had quite a bit of money come down for rental and utility assistance.
Now, what support have you provided for those experiencing homelessness?
So, because of the pandemic, we had to follow the protocols for social distancing and making sure that providers were following and using PPE. So we lost some shelter bed access in our community. So one of the things I want to really admire our community for, and working very closely together between the county, the city of Vancouver, Peace House Community Fund and the Community Foundation of Southwest Washington put in dollars to do motel vouchers. And so because a lot of people were not vacationing, a lot of the motels opened up. And so we were able to use that to help shelter. We also, we did still have our shelters operate. They were just at reduced capacity. So we gave them some additional funding as well. And then we actually, the county actually operated the largest shelter that we ever had in the county. And that was for the quarantine isolation for people unhoused. And then also we had it was two buildings, and the other side was a shelter for people at risk for the for COVID-19. And we served about 270 people in that shelter, and we operated from April to early December. So that was what, and we helped also pay for some additional outreach services. So that's what we were able to do to kind of help the people that were unhoused in our community at that time.
And what support has been provided to struggling small businesses during this period?
So we worked directly, my department worked directly with Fourth Plan Forward and then Mercy Corps, and they actually helped small businesses that were minority owned or women owned or veteran owned. And they were able to help 221 businesses during that with some small grants. And so, and some of them also helped with those businesses to get some PPE. So we were very fortunate to also be able to help those very small struggling businesses that needed some additional assistance.
How did the pandemic impact the community need for behavioral health?
Behavioral health, an important need during the pandemic with a lot of people with isolation. A lot of the behavioral providers had to move to telehealth and operate remotely and virtually. And so we know that's not the best scenario, but we work very closely with behavioral providers to know where they can get access to technology, laptops, be able to help to move to that virtual format. And so we worked with the state to make sure that they knew how to connect with the providers. And then we also did some advocacy with them to make sure when it's time for them to get vaccinated, how they can get access to the vaccine. So, you know, I want to give a lot of appreciation to public health and the state for helping to make sure behavioral providers were prioritized during that process.
Calls for social justice and equity were another huge issue impacting not only Clark County, but the nation as a whole. What steps did community services take to respond to this issue?
So, you know, my department has been working working on diversity, equity, and inclusion for over 13 years. All of my staff are trained in the area. And we also make sure that we work with our providers around it. So one of the things that we did specifically for the pandemic was we actually did better outreach. We worked with 11 organizations that represent communities of color, disabilities, veterans, women. And we made sure that we funded them to make sure go out and do outreach so that people would know where to get access to utility and rental assistance. And so that was different for us. We wanted to make sure that we did better outreach, especially during this important time. And then the other thing we're doing is working with our nonprofits on trying to better help. And we're also learning how to use an equity lens so that you can better serve everyone in your community and make sure that you're addressing institutional discrimination and especially racism. And so you can better provide a better product and service to the people that we're here to serve.
If people want to connect to just some of the services we discussed today, where can they check?
You know, the first place I would tell people to do is call 211. And so they have a lot of updated information for Clark County about the services we provide. But they can also go to the county's website, which is clark.wa.gov, and go to the community services page. And right on the front page underneath community action and housing, there will be a link for COVID-19. So if they want to access, they'll figure out how to access some of the services, they can get that information. They can also call our main number and leave a message because, again, we're still operating telecommuting. But that number is 564-397-2130 with their specific requests, and somebody will call them back and give them the resources where to contact somebody for help.
Well, thank you so much for your support during this time of need in our community.
Well, thank you, and I appreciate you having me.